states, so where we react quite a bit, and we also uh, kind of take it everything unnecessarily stressful reaction, right? So not to react, deep breathing really helps because it stimulates parasympathetic nervous system, right? So that's why we're going to do a lot of deep breathing as we do stuff, okay? And then we're going to uh, really do some exercises that will stretch your body and breathe energy into it, and also help us really cultivate an attitude that we are really here and now all the time. Okay, so let's start by stretching a little bit, and also we will go into a mode where we really identify who we really are, that energy beneath, right? So I'm in my study today, and let's start by standing or um, you know sitting, whatever is convenient for you. Yoga is more like a sthira sukham asana, stable, comfortable postures. So don't do anything that is painful, that is uncomfortable for you. Do it in a stable and pleasant condition. Okay, it should be more like a easy, not really hard. Okay, if you are doing very hard, then you are doing something wrong. Listen to the body and allow it to really go into it as much as possible. Okay, don't force it, just ease into it. Let's start deep breathing. This is called Bastrika, the first one, which is a normal breathing in and holding and breathing out. Okay, we do this every day by sitting posture or standing posture with the spine is straight, and as you breathe in, the abdominal wall raises up as the diaphragm pushes it down, and hold it for a few seconds, and then take a deep breath in and blow it out completely as the abdominal wall goes towards the spine. So posture is important, empty stomach is important, and when you are breathing, abdominal wall raises with the inhalation and abdominal wall goes to the spine with exhalation. I prefer to do this before a meal, before breakfast, before lunch, before dinner. So we're going to do altogether 8 times. Okay, so sit straight, and then now close your mouth and do all the breathing through the nose. As you breathe in, abdominal raises, and hold it there for a few seconds and breathe out. Look at my right hand. I'm on the video on the YouTube, LinkedIn, and Facebook. Okay. Second one done. Three done. Four done. Four more to go. Three more to go. Two more to go. Last one. There you go. So that is Bastrika. Very simple but effective exercise you can do every day. Okay. Now we're going to go into the second variety. Raise your palms so that they are shown to the camera. Elbows bent initially, and as you extend the elbows up over the head and hands going up over the head, take a deep breath in. And as you bring it down, breathe out. You can do this at office, sitting down and refreshing yourself completely. Okay, you can do that several times of the day or a couple of times of the day, whatever appeals to you. Okay, and the last one, clasp both your hands together and put it under the chin. Okay, and as the elbows bend to the side, raise them to the side and above your shoulders, and let your head fall back. As you take the deep breath in through the nose. At the top, open your mouth and whisper the word ah as you bring the elbows down, head back to normal. Breathe out. See how prolonged that is. 2, 3, 4 done. 4 more to go. 3 more to go. 2 more to go. Last one. See, that is 4 of them. Okay, 8 of them altogether. Okay. As you do this, you feel so refreshed initially, or it may be tough for you. That's okay, as long as you are able to do that. Practice and do that as much as possible. Follow the principles. Empty stomach is better, and straight spine is important, and taking the deep breaths in and holding and out. Okay, those things help. Do as much as you can. Preferably count of 7 inhalation, 4 holding, and 8 exhaling. Okay, and now that we have really preliminary breathing, let's go and do some yogic exercises. Okay, here assume the posture, stay there for a few number of breaths, 3, 5, 8, depends upon you, upon your time also, and make sure that you are keeping your mind here and now on the air coming in and the changes you feel in the body. Whatever you do, be here and now. That is practicing to be in the present moment while you're starting the morning routine, and take it to the work. Okay, take it to the energy generated to the work, take it the presence to the work, and take it to the purpose that you are doing what you are doing to the work. So if you can practice those things and then take them, it's less chance that you will generate stress in your life or you burn out because of the overwork and all that. So you are preparing your body, your mind, and your heart for the work. That's the purpose of this morning routine. Okay. Otherwise, anybody can do whatever exercise they want. But the same principle applies if you are jogging, if you are running, whatever doing. Okay. But this stretches relieve a lot of tension in the body, and the breathing helps you calm down in the nervous system and also generate parasympathetic nervous system activity, which kind of makes you non-reactive. So don't react to everything. Respond to your duties with the emotional balance. That balance you want to get it here in this workout. Okay, don't think of anything else except what you are doing here. Okay, bring your mind back to normal, to the breath as the anchor. Then your mind is not going to go all over. Okay, cultivate that. Now let's do, clasp both your hands together. Okay, and then show them to the camera by extending elbows forward. Okay, and now take them over your head all the way above. Okay, and stretch to the ceiling both elbows, and now come up on the toes by lifting your heels up and stay there, and twist to the left side, the whole body, and then turn the head over the left shoulder to the back. Just stay there for 3 breaths. And come back to the center. This time, twist the body to the right, and turn the head over the right shoulder to the back. And come back to the center and lean back. Lean back and take the hands and elbows and shoulders, and head and neck to the back as much as you can. And come to center and take the hands down between the knees towards your feet and bend forward, and take the head between the knees. 3 breaths and come back and relax. Take 3 deep breaths here. Don't watch me, just do it. You can watch me till land, but once you are into that, allow the body to go through the exercises and keep the mind here and open your heart and do it with heartfully. Okay, that is one stretch that we do. Now, take the right hand to the left shoulder and left hand to the right shoulder. Sit tall and now turn the whole body to the left and lift up the heels and bay on the toes. And turn the head over the left shoulder to the back. And come to the center. Now keep the feet up like that, on the toes. Heels are up. Now turn the body to the right. First the body, turn to dorsum, okay? And then turn the head over the right shoulder to the back. And come to the center and lean back. Let the head and neck fall back as much as you can and stay there for 3 breaths. Now come to the center and fall forward at the lower lumbar spine and take the head between the knees. Keep your heels up all the time if you can. That will give you activation of the body. That's why. And now let them go and bring the heels down and rest for 3 breaths. This may appear slow, but then very effective, right? So that is the important thing, is to slow down and don't run with your mind. Okay. All the builds and everything you could do later, but in this hour, here and now, be here and now. Okay. Important to consider that. Okay. Now we're going to do the third stretch for the spine. Okay. So take the right hand and place it on the left knee, and then take the left hand behind your back towards the right side of the chair, and then twist to the left side, the body and also the head and neck, and look at the back, something in the back. Unwind and come back to normal. This time, left hand goes to the right knee and right hand goes behind you towards the left side of the chair, and twist the body to the right and head over the right shoulder to the back. You see, we are doing spinal twisting during these stretches. That wakes you up. And there you go. Always try to slow down and get back to your breathing and make it deep as much as possible. Okay? 3 deep breaths. Now we're going to go and do what is called Surya Namaskars. Okay? That is sun salutations. So what you do is keep both feet as close as possible on the floor and keep your both hands on the knees. Okay? And now raise upper extremities with elbows straight front and go up all the way above your head, all the way above your head, and taking deep breath in. And let the head fall back too. After that, breathe out and bring the hands down with elbows extended and head coming towards the knees. Okay, come down, take the hands all the way to the feet. Okay. Now Keep the left hand on the right foot and elevate the right hand to the side. And turn your head and look at the right palm, which is away from your body, right elbow extended. And then breathe out. Bring the right hand to the left foot and left hand up, elbow extended to the side, and turn the head and look at the left palm on the side. Breathing out, come back to it and come up and hold on to the right knee with both hands and breathe out and bring the thigh to press on the abdomen. And then do the same on the left side. And now keep the hands up again and go back. Take a deep breath in. As you breathe out, bring them back to the knees. This is a modified version of sun salutations that you could do anywhere. Okay, do those maybe 10 times, 20 times as your time permits. Okay, that will really refresh you because you are doing up and down to the side, the spinal twist. Okay, and also you're doing the deep breathing. Okay, as you go up, breathe in. As you bend forward, breathe out. That's what you want to remember. Okay, there you go. If you want to see the video, go to YouTube and then you can see it again and again till you get the technique. If you already have the technique, repeat that as many times as you can. Okay. Now, that is the sun salutation. I just showed you half of it really, but you can do both sides of the body several times a day. Okay. It's better to do in the morning and in the evening. Okay. And now we will do some stretches. Okay, sure. Lift up the left hand, elbow straight, and the hand is up and towards the camera. Okay, and now take your right hand and pull the left fingers and bend the wrist towards you. Now let go the right hand and turn the fingers down, left hand fingers, and pull them towards you with the right hand. Show me the right hand up and facing the camera, and right hand fingers are pulled by the left hand towards you and bending at the right wrist. And point the right hand fingers downward and pull them towards you with your left hand. Now hold on to the left wrist with the right hand and elevate the elbow above your head and pull it towards the right shoulder. Do the same on the other side. Right wrist with the left hand and pull it towards the left shoulder. Place the left hand on the right shoulder and hold on to the left elbow with the right hand and pull it towards the right shoulder. Do the same on the other side. Right hand to the left shoulder and left hand pushes the right elbow towards the left shoulder. Do the stretch well and feel it and be with the stretch and deep breath. Okay, and now place the left hand on the left shoulder and hold on to the left elbow with the right hand and push it up all the way. Feel the stretch in the triceps. The same on the other side and push it up. And go down. Okay, there you are. Those are all exercises for the upper extremity. Okay, fingers, wrist, elbows, and all. Okay, now let's do some shoulder exercise. Put both hands on the side of your body like this and then elevate them to the side. Elbows are straight, palms are straight, but then palm is facing down. Okay, and fingers are extended. So extend your both upper extremities away from your stretch to the side. And now make a round with the fingers on the periphery. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Opposite way. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Bring the hands back to the knees and relax with 3 deep breaths. Now, let's raise both hands with elbows extended forward, palms facing each other, fingers straight to the front, And now relax your shoulders and then turn the palm away from the center. Okay, they're opposite to each other now. Now push like you are in the water, swimming back. Okay, both hands are going back, and then extend the head back and feel the stretch. Imagine you have a pencil between the scapula and you're crushing it. Now turn the palm forward and bring them forward again. And head normal. And now raise the hands just above the shoulder level and turn them outward and swim again. And swim again and bring both scapulas together. And head turned backward and stay there for 3 breaths. Now bring them back to the front again and raise them above your head, turn the palm outward and go back. Well, with 3 levels, right? And come back. See, that's a very good exercise for shoulders. Okay. Okay. Now we're going to do some exercises for the calf muscles and also for the knees and the hips, and we'll come back to the side of the abdomen, chest, and also we come to the neck and head. Okay, so lift up your heels, up, you are on the toes now. Take a deep breath in. As you bring the heels down and lifting up the toes, breathe out. That is 1. 2, 3, 4, 4 more, 3 more, 2 more, last one. Okay, that is for the toes and ankles, and also more importantly for the calf muscles, which is our second heart leg. Okay, and now extend your knee by lifting up the right foot all the way up and showing the foot to the camera. Okay, breathe in as you come in and breathe out as you go down. Do the same on the left side. That is 1. 2. 3, 4, 5, 6, 7, 8. See, that is for the knee joint. Now we're going to come to the hip joint. Clasp your hand together and make it like a cup-like and make it around the right knee. And as you breathe out, bring it to press on the abdomen. The thigh presses on the abdomen. Breathe out as you come close to the abdomen. And breathe in and take it down. 2, 3, 4. Let's do 4 on the left side. Put both hands around the left knee, and as you breathe out, bring it up to press on the abdomen. Breathe in and go down. 2, 3, 4. Okay, that is for the hip joints. Now we're going to come to the side of the abdomen and chest. Let both your hands hang on the side like this, elbows straight down and palms are facing each other. Now lift up the right hand up, right elbow straight, and now turn the palm upward and bring the right upper extremity straight so that it touches the right ear, and the elbow is straight up, hands are up too, okay? And now dip it to the left side. Feel the stretch on the right hand and come back to center. 1. Breathe out. Breathe in. Come back to center. 2, 3, 4. See, this is four times on the right side. Now lower the right hand down and keep it hand down, hanging there, and lift up the left upper extremity to the side. Elbow is straight, palm facing down initially, turn the palm up and bring the whole left arm up, elbow extended and arm touching the left ear. Now dip it to the right side. 2, 3, 4. Okay, now lower it down and sit down and relax. These stretches, if you do it very well, they will really nourish that part and get the tension out of there, and also get ready for work, and then you won't pull that easily anymore. In the summer, you won't have the cramps and all. Okay, there are a lot of hidden values with the slow stretching. Okay, but with your mind here and deep breathing. Okay, you have to be aware, and you have to align your body, breath, and breath. Okay, and also you have 4 actions we do and 3 attitudes. Okay, so 2 A's, 3 B's. That's how I remember everything. Okay. Now we're coming to the chest muscles. Okay. Bend your elbow to the side on the left hand, and left hand is on the chest. Now place the right hand on the top of the left hand and right elbow bent to the side. Okay, like this. Now release the right hand out to the side, elbow extended, and then twist the body to the right and turn the head over the right shoulder and look at the right palm. As you breathe in, you go back like this. Now breathe out and bring the hand back to the chest. Right there. Okay, now do it on the left side. As you breathe in, you take the hand to the side and to twist the body to the right, to the left, and then look at the left palm. Breathing out, come back to center. So that's 1. To the right. To the left. That is 2. That is 3. 4. 5. 6. 7. 8. Okay, that is for the chest muscles, pectoral muscles. Okay, that's what happened. And now, okay, I had a call in between. Okay, we come all the way to the top, right? We did a lot for the shoulders, so let's go to the neck. Look straight first, and then take a deep breath in, and as you breathe out, go. Breathe in, lift up the chin to the up, till the head falls back. Breathe out and bring it to the normal. That is 1. 2, 3 more. 2 more. At least 5 rotations we do with the neck. Now to the side up. Okay, turn the head to the side. To the side. And come back to the center, to the right. As you take a deep breath in, turn the head to the right and breathe out and come to the center. Okay? Two more. Last one. Okay? That is side to side, right? Now bend the neck to the side. First to the left side, so the ear is trying to touch the left shoulder. Bend it to the side. Don't be too violent. Just allow whatever it can do. And breathing out, bring it to the center. To the right. 1. In the morning time, you feel the stiffness more. It's much more difficult to do it. But in the evening, you can do it much easier. Try to start with the evening time and then switch to the morning time. But you will get more benefit if you do it in the morning time. Okay? It's your choice. Okay? Lot of times as you age, you'll have a lot of stiffness in the neck. So these exercises are very good for that. Okay? And now make the chin fall to the chest and sweep the left ear over the left shoulder. Go back as you take the deep breath in, as you sweep the right ear over the right shoulder and come to the front, breathe out. Okay, as you go up, breathe in. As you come down, breathe out. One more. We did 3 of them. Do the opposite way now. 3 more. Always remember, as you go up and to the back, breathe in. As you come to the front, breathe out. 2. 1 more. Don't be violent with these movements. Don't be hurried. Do it deliberately, slowly, coordination with the breath. Okay, then you will get a lot of benefit. A lot of stiffness will go away from the neck. Okay, but if you have too much pain, watch it. It could be something with the nerve or the bone. So first get it cleared by the doctor and then do these movements. Okay. Don't be violent with the body. Allow it to go into the stretches slowly. Be friendly, be kind and compassionate, and then those strains will go away. Okay. Now we're going to go to the face. Okay. Bend your right uh, elbow and bring the right hand to the cheek, elbow to the side. Okay. And now press the right cheek and release. Press and release. Press the right cheek into the right hand and release 3 times. Do the same on the left side. Now take both hands and place them on the temples and press and release. Lot of tension in the face that we relieve. Now press the forehead and release. Press the forehead and release. Top of the head. Press it down and release 3 times. There is an occipitofrontalis muscle that's covering the scalp that gets tense. A lot of people have headaches there too. So put both hands behind your head, press and release. Press and release. See? So we have started at the toes, ankles, knees, hips, side of the abdomen, chest and shoulders. And now we'll do something for the elbows. Spread both your hands to the side, elbows straight. Now bring the fingers to touch the shoulders as you breathe out. As you breathe in, go out. 1, 2, 3, 4, 5, 6, 7, 8. See, I do this with you guys, so I get the benefit too. So I get the benefit of stretching, breathing in, and keeping the mind here, and all that. All those benefits I get them right now. Okay, when you do this, you pay attention, you really be involved in what you are doing, then you get the benefits right away. Okay, but it varies according to how you do it, how long you do it, and how sincerely you do it. Okay. Now raise both hands to the front and do the up and down movement for the wrist. 2, 3, 4, 5, 6, 7, 8. Now tuck in the thumb and hold all your fingers on the thumb, and now do the up and down movement of the wrist. 2, 3, 4, 5, 6, 7, 8. Now rotate the hands in one direction. 2, 3, 4, 5, 6, 7, 8. Now 1, 2, 3, 4, 5, 6, 7, 8. Now open the fist and make a fist. 2, 3, 4, 5, 6, 7, 8. Okay. So we have done head to toe most of the exercises, right? You can do a lot more, but we'll go into the formal breathing practices. These are very important. You get a lot more benefit with your energy, first of all. Second thing, you'll have a stable nervous system if you do this breathing exercises properly. And you will be less reactive emotionally because your nervous system calm down and you won't have the quick reaction, emotional reaction. Rather, you will respond to anything that you do with the emotional balance. Okay, that's important. Okay, and don't be emotional for everything. Don't be reactive for everything. That's what's happening in the modern life. And people are worried about things and they don't do, they relax the flow like manner. Whatever you do, try to do in a flow like manner. Okay. Now, so first three exercises are hard on the abdominal wall. So if you have any abdominal pathology like a gastritis, colitis, irritable bowel syndrome, whatever you have, be careful. Even if you have a recent surgery and some operation, don't go and do this. First get your clearance from your doctor and then do them slowly and being gentle to yourself. Okay, don't have to compete with anybody, don't have to compare yourself to anybody. Do whatever is comfortable for you. Okay, with that warning, let's do Kapalabhati first, then Agnisara, then three bandhas. Okay, Kapalabhati is the fire breath. Like you you sit straight, and then as you withdraw the abdomen into the spine, you breathe out. That is the maneuver you do up to 60 times in a minute. You can start with 5, okay, and then advance slowly. First, get the technique first. You are withdrawing the abdominal wall inside as you breathe out. You don't do the inhalation happens automatically. All you focus on is breathing out each time. Okay, look at me first. See, look at my right hand. Okay, 60 times in a minute. Okay, you can go on doing 5 to 15 minutes. That is a wonderful thing if you can do that much. Okay, but got to go very slow. Maybe if you have started with 5, you will be 30 in a month, every day 5 increase, and you will be 60 in 6 months. And you will be doing 5 to 15 minutes in 1 year. It has to be that slow. Okay, don't be hurried. Okay, and now we're going to do Agnisara. This is a metabolic stimulator. What it is first you take a deep breath in, then breathe out completely, hold the breath there. While holding the breath, move the abdominal wall up and down, whatever little movement. Even if you have big belly, your underlying muscles will walk. Try to do that, prevent that, okay? Pretend that, okay? Now, first take a deep breath. I did 20 times, but you don't have to do 20, you can do fewer. First to get the technique correctly, okay? If you have any doubts, DM me, then I will help you, okay? Okay, now we're going to do what's called three bandhas. Bandha means lock. As you breathe out, suck in the lower abdomen and lock it there. And that's one lock. Then suck in the upper abdomen, lock it there. And then bring the chin to the chest, lock it there. And stay there without breathing in and out for a few seconds. You don't have to stay for long. Okay. First, assume the lock position. Breathing in, come back to normal. This is a very powerful exercise if it's done properly, and it massages the abdominal pelvic organs very well. That's why it's a very healthy thing to do, and it really gives you the six pack too. Your abdomen will be flat. Look at mine, 70-year-old, I have a flat abdomen. Okay, so you can have that if you're doing every day. Okay, it does help you with the posture because abdominal, the core muscles are really tightened. Okay, one other thing you could do is, okay, as you breathe out, bring the chin to the chest and then contract the abdomen and then try to move it from side to side, abdominal wall. That is also very effective exercise for constipation, gas problems, anything like that. Okay, there you go. So that is a very good exercise to do. So what we have done so far, Kapalabhati, Agnisara, three bandhas. Now we're going to do what is called alternate nostril breathing. One nostril one time, other nostril, like that. This is called Anuloma Viloma, Nadi Shodhana. Okay, this is to improve the efficiency of the breathing, to make both nostrils breathe at the same pace and rate. We do the, okay. What we do is you take the right hand and bend the index finger and place it at the base of the thumb, also the middle finger. Okay. Now use the thumb to close the right and the ring finger left. Okay. First, what we do is we close one nostril at a time. First, to close the right with the thumb, gently place there and close it. Close your mouth and take the deep breath through the open left nostril. After taking the deep breath in, close the left nostril with the ring finger and release the right nostril and breathe out through the right nostril. Now, take a deep breath through the right nostril, close the right nostril and release the left and breathe out through the left nostril. See, you got that. Okay, start with the left, go to the right and come back. Now start with the left again. Two cycles down, three more. Two more. Last one. That is almost a minute we did that. You can do 5 to 15 minutes over 6 months. That will be very good for you. If you can do only two breaths, Kapalabhati, the first one we did, the fire breath, and this alternate nostril. If you do these two, 5 to 15 minutes daily, not even weekends or all, daily. If you do that, you will have immense health benefits. Okay? Something I am enjoying, I'm telling you. You can enjoy the health benefits if you do these things. Okay? Nothing mystery about it. Now, we are going to go bumblebee. Take all your hands, all your fingers, right? Use both thumbs and close the ear canals. And you keep them closed during this exercise, okay? All the 5 times, okay? And then keep the index, middle finger on the top of the forehead. Close your eyes and keep the ring fingers on the closed eyes gently. Now let the little finger hang around the mouth. Close the mouth. All the breathing is done through the nose. You closing the eyes, ears, and the mouth. And as you take the deep breath in, take it normally. And as you breathe out, make a noise like a bumblebee. You can do number of times like that. Okay. This is very good for speakers, for singers, and even to talk normally. All the secretions will go away and very protective for the respiratory infections. Okay. So COVID especially likes the respiratory tract, right? So if you don't have any secretions going into the lung, that's very good for you. So do this if you have lung COVID or if you have any infections and all that. Okay. And now we're going to go into the Auma, okay, whereby we kind of take a deep breath in, and when you are breathing out, first to say Ah 5 times, each time breathing in, breathing out. That is for the abdomen. The nerve channels, or not nerve channels, nadis, the energy channels will open up with that resonance of your sound. So don't, let's watch me. Do the sound yourself. That your own sound resonating through your system helps you. Okay. So first we will do Ah for the abdomen, U for the chest, Ma for the neck. Okay. Ah. 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 Now we'll do for the chest. Ooh. 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 Now, ma. 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 Okay. That finishes most of our breathing practices. They're all done to make us more aware, awake, alert. That is the A of the AEIOU. And the E for the energize the body. And you will do that with all this deep breathing, right? I is the insight into where our body is and where our mind is right here and now. Okay, that's the insight you get. Okay, your mind is going all over. That is that insight into how your mind is taking you all over. Then A, E, I, O is the Om that we split into A, U, Ma, and we did that for the energy activation. And U is the last one we're going to do. We are going to identify with the universal consciousness which is in us as conscious being, as witness consciousness, witnessing our body and the mind. So don't identify with the body, don't identify with the mind, but identify who you really are, which is that energy, which is that consciousness, which is that conscious being, which is that witnessing your body and mind. So try to accept and affirm yourself that you are that conscious being, not just the body and mind. You have a body, you have a mind, they are your tools. This is important. In yoga, once you identify with the conscious being, then you can manage the body and mind much better. Okay. So what we do here is we'll assume this is called Chin Mudra, and then keep the hands on the knees like that, palms down, and now sit straight and tilt your head a little bit back, close your eyes, but keep the gaze in between the eyebrows. And now close your mouth and take deep breaths through the nose. As you breathe in, you say, "Who am I? I am the witness consciousness." As you breathe out, let go your attachment to the body and mind by saying, "I'm not just the body or mind, but they are my tools. I'm going to use them well." Okay? That's what we're going to do for 10 breaths. Koham, soham, deham, naham. Who am I? I am the conscious being. I'm not just the body or mind, they are my tools. Koham, soham, deham, naham. Who am I? I am the conscious being. I'm not just the body or mind, they are my tools. Koham, soham, deham, naham. Who am I? I am the witness consciousness. I'm not just the body or mind, they are my tools. Koham, soham, deham, naham. Who am I? I am the conscious being. I'm not just the body or mind, they are my tools. Koham, soham, deham, naham. Who am I? I am the witness consciousness. I'm not just the body or mind, they are my tools. With that, we are done with the morning report, and I'm going to bring in other people who want to be in this next 15 to 30 minutes of discussion, so that people had some questions yesterday about some things, so I'm going to address them in this next few minutes of talk. Okay, give me 1 second. And I'll bring them in. Hello, Michael. Hello. Maybe he's accidentally came in. Okay. So anybody has any questions or anything you want to talk about? Yeah. Michael wants to come up? Okay.
Good morning.
Good morning. How are you, Michael?
I feel better than I felt in months. I'm so glad I found your morning routine, and the YouTube helped.
Yeah.
So I keep the off YouTube and I keep you on Noom.
Okay.
But I look back and forth, and
yeah,
you are not a master of the universe. You're the master for the universe. There are people who could benefit so much. I'm glad you're getting out there on all the platforms and yoga. My mother did yoga into her 70s, and you may recall I lived in Japan for 4 years.
Yeah.
So I'm inclined to call you sensei. What do we call a master or sensei or a doctor, teacher in Hindi? Or what do you...
They call guru.
Guru, right.
Yeah.
I've heard that. Okay, I didn't know if it was the same as sensei. So
I have a lot of respect for the Japanese. I'm into the Ikigai. I teach all the skills that the centurions in Okinawa do.
Yes, the blue
Yeah,
zone.
yeah. So I'm very much interested in that. So
Well, they're good with the diet too, but we
yeah,
have to put all the components together. I'm trying to stay away from the meds,
yeah,
as you have said.
yeah.
I've had some health issues. I have a lumbar spine compression fracture, so I'm easy on that.
Mm,
You gave me the best advice when you said to go to my gym
yeah,
and go to the instructors and ask them to let me do my physical therapy in the pool.
mm,
And it's a sea salt pool.
yeah.
And I'm getting better with that, lower impact, etc. So thank you for that advice as well.
No problem. Yeah, actually, that's a lifestyle we should be promoting as physicians and telling you. You see, best health practices are those that prevent illness, that eliminate illness. We have the knowledge from the ancient times to modern science. We have a lot of knowledge like
Yes.
that. So I'm very interested in everybody getting proactive about their wellness.
Well, thank you. And we need reminders from
Yeah.
gurus like you. And the Japanese, I have to admit, when I lived there, I realized they promote wellness, whereas our country promotes sickness and medicine and fixing broken things. I tell my doctors I feel like I'm falling apart in slow motion, and they said, no, just do better. Even some doctors I have that are Western, they appreciate the Eastern viewpoint.
Yeah.
And when they realize that I'm into it, then they open up.
Yeah.
The longevity and the blue zones and Okinawa and all that. I did have one major question though about breathing. By the way, I've never heard butterfly or the AEIOU. Those were two mind-blowing things that I learned from you today.
Well, I'm very proud of that.
It's important.
I'm very proud of that, Michael, because it came to me, AEIOU. It fit in very well for our routine. We just want to be aware. We just want to be alert.
It's a good way to remember when we forget. But the major question before I forget about breathing, what I think I learned in Japan with yogic breathing, or there's a beautiful, I'll talk to you another time, another conversation, but there's a beautiful Japanese temple in upstate New York on the Hudson River. And they do, weekends or weeks and, summers, they do all kinds of training. But one thing I learned was breathing in through the nose and out through the mouth. Now, how important is it to breathe? Either one is the same, or that's a major question.
We want to encourage mostly through the nose, because nose is there for the breathing, right? Sometimes people breathe in through the mouth and they have what's called aerophagia, a lot of air in the stomach. Okay, so we don't want that, and that's why it's actually the nose, all that going into the lungs is important. We're not breathing into the abdomen. Okay, abdominal wall can raise because the diaphragm pushes the everything down. And that's why it's a measure of how deep you are breathing is like abdominal wall raising, but not you are breathing into the abdomen. Okay, so
that makes sense. Yeah, but breathing out through the mouth, how is that?
That's fine too. That's fine too. But then breathing in through the mouth is the problem. We don't want it. Only but breathing through the mouth also sometimes it is much deeper for you, and then it helps you. Okay, so either way it's okay, Mike. But as long as you are breathing in through the nose. Okay. That's a good question, Michael put in, because there's a lot of confusion about that, and the people really do the wrong thing sometimes. Okay, so that's a good thing.
As I think I had another question. I wanted to say that you should understand that the people on here, if we don't come up and speak, that's not because of you, anything, that's because people are maybe, just afraid or.
No, that's the thing. You see, I want them to feel like
a big impact.
See, I operate with this feeling that all human beings are in one family, right? So nobody needs to be intimidated by any of this because everybody has to go according to their journey. Okay, wherever they are, they should start there. Don't compare, don't compete, but do it together and also ask questions because I want them to progress, not to stall at any point. And there will be a lot of questions because if they are listening to me and not seeing me on the video, sometimes it is difficult, right? So that's why any questions I want to come up.
I think you can feel the collective consciousness
Yeah.
and mindfulness
Yeah.
and thoughtfulness by any responses or even
Yeah.
no response. I think you get it. So.
Yeah, I know, I understand, but I want them to feel free to come up and ask me. And actually, I'm doing a retreat next month in the middle. That is about enhancing the human being from wherever you are to the next step. So suppose you have a very stiff body, you can understand how flexibility can be increased by just breathing or not. Okay, so that's one thing. And then suppose you are really restless in your mind, then you can understand I can keep it under control and all those things. Because I want to attend to several layers of our personality, which is our body, mind, and spirit and heart and all that. Okay, there are 5 layers in yoga. Annamaya kosha, that means body, the physical body, and manomaya kosha is the mind, pranamaya kosha is the energy body, and vijnanamaya kosha is our understanding. Okay, and then anandamaya kosha is the states of happiness, bliss, and all that. Okay, so when you do something like that, it's much better. So that's what I'm trying to do. In that, it will be 2 days, 3 hours each day, and they will have 4 components, and they can work with whatever appeals to them, whatever applies to them. Okay, rather than being oh, you have to be like this. No, what are you at, and where you want to go? Suppose some people have real emotional problems because they have been harassed by the work environment or the bosses or whatever. Then you can understand how not to react, but at the same time take the criticism in a constructive way and improve yourself. So I don't want people to be wasting themselves by not understanding their own instrument, body or mind. Make sense, Michael?
Yeah, absolutely. I think you're in New Jersey for some reason, but do you have the dates and location of your retreat?
I'm going to send the flyer out today so that people know the times and dates and how to sign up and all that, we are doing ahead of time because so that people can, you will hear several times from now onwards when the dates and time. This is in the middle of January, Michael, Saturday, Sunday, okay? Only 3 hours each day, that's all.
Okay, and what roughly the dates are? January?
In the middle of January. I have to see the Saturday,
and the
Sunday.
Location is New Jersey, right?
No, online. It's going to be complete.
Online, okay, great.
I'm in Iowa.
Oh my gosh, okay. Well,
I lived in New York.
Stuck in New Jersey. It's very cold here. I'm sure it's cold in Iowa.
But. I lived in New York for 8 years, so I know New York very well. I know the Japanese place you are talking about too. So.
Oh, okay. Yeah. Well, yeah, Daibosatsu Zendo. They're in Livingston Manor, New Jersey, up past the Hudson River. So, have you been there? Or?
Yeah, I was there. I have been in New Jersey for several reasons, friends and all that. So.
Right. Well, you have your finger on the pulse, not just Iowa, but New York and the whole world, but the country especially. We're in bad shape. We need help. So, thank you for helping.
Yeah, sure. Thanks, Mike. So. I will be announcing that date and everything, and hopefully everybody.
Thank you.
Okay.
All right, I'm about to sign off, but thanks for everything. God
sure,
bless.
Michael. Thank you for coming up. Okay. Anybody else wants to come up, and you can come up and we can talk about it. There was something I saw yesterday about the face scan, and I was going to present my views on the face scan. How that is there in a way in ancient systems, not scanning the face, but then they look at the tongue, like what the texture of our skin, and they used to diagnose. They called Nadi Pravina, and they were able to do lots of diagnosis just by that. So this technology is good, provided you take it in the right way, and also it doesn't allow any psychological disturbances within you, because some people don't want to know that they are suffering this problem, right? So that's also there. So I'm going to do the talk later on the face scans, because I heard it on Dara's room yesterday. But I'm an informatician, so I'm in touch with the latest technological tools for our wellness. I know that nanotechnology is improving, and also AI can do a lot more than what we are anticipating. So it is pretty soon. It's not going to be several years down the line. It's going to be probably next month, next year, like that. Okay. So I'm in touch with that, especially for proactive wellness. How can we use these tools to promote not self-diagnosis, but self-aware of your health condition, and uh, deep within your biology, what's going on, and then change your lifestyles to correct those abnormalities or impurities, or not normal things, right? So this technology can be leveraged to maintain your wellness. Okay, I'm going in that circle. Okay, so I've been in informatics since 2008. I have a master's in biomedical informatics, so I'm very much interested in our biological age and our chronological age, how centurions in Okinawa, I was mentioning with Michael, how the centurions in Okinawa keep themselves very well just by some lifestyles. We're going to explore that, and also we can use something like this very well. Okay. So before I hang up, anybody wants to say anything or ask me anything? Otherwise, we will see you again tomorrow morning for the workup. Okay? Okay. Thank you, and I'll see you tomorrow morning. Bye bye.